The voice that you may have heard from me is not the only voice in dentistry that has these thoughts that are a little out of the normal parameters of dentistry. And Dr. Trivedi and I were told to meet each other, I think about 15 years ago. We actually got to meet each other a few years ago, and I regret that I didn't follow up back then, because I love everything he says. He has his own channels, and we'll put links to that. But let's start just discussing some of the things we know that we find difficult in dentistry. What would you say to people? What's the most important? Why should they care that they, right now, what can they do? If they normally go every 6 months, should they keep going? Should they look for a different dentist? How do they know what to do? What should I do, Dr. T?
I mean, that's the interesting part is if you go to other cultures, and I don't compare America to other cultures, but you go to other cultures, for example, I was raised, my parents are from India, and no one taught my mother and father how to do anything. They didn't have dentists. They didn't go to my parents didn't go to a dentist till they came to here, and they were in their 40s. And so that knowledge of taking care of your body, your mouth, and your teeth, that was passed on from generation to generation. And somehow in this country, it was just cut off. And now people like, I don't know what to do. I'm like, but that information's been around for a really long time. So I think for people, once they find a dentist that they communicate well with and they trust, just ask them, what can I do to ensure that my care has longevity? Like, what are the changes I need to make in my life to make sure that I have longevity, right?
Well, it's you want to know, probably the most damaging thing is to have bad health in your gums, right?
Yeah.
Periodontal disease impact on the body is pretty wild. Then fillings, because you're a biomimetic dentist, the importance of a good filling. Do you think most people know?
I don't think most dentists know. And I know that's inflammatory to say, but when we were in school, we're taught the basics. And I mean, sometimes the things I say, obviously dentists are the ones who, when I say inflammatory, these are the people I'm talking about. These are general dentists who are like, you're crazy or whatever. But
I agree with you 100%.
When you're in school, whether it's dental school, medical school, or any professional school, you got your A, B, C, D. Well, you pass that C. So when a dentist is doing a filling, you're probably getting a C grade filling because that's passable and that's what they've been taught. Well, this works. And the problem with dentistry is if I do a C level filling, you're going to be fine. But then eventually that filling is going to degrade at a higher rate. But because you don't see it happen right away, this complacency is built into the system.
Absolutely. Absolutely. The 10 to 13-year lag time.
Yeah.
Where you just had this white filling put in that actually is a lousy seal.
It looks great.
It looks great from the top, but it's catching plaque at the junction if it's a two-surface filling. It's got irritation now causing to the gum underneath it that the patient's being blamed for, but it's really the way that filling actually merges with the tooth, the rest of the tooth. Right?
Yeah.
I mean, that's the most damaging thing you can do to a patient. And how many patients suffer because the filling wasn't done ideally with the right shape, particularly a two-surface filling.
I've heard reports. Now, these are just like statistics that's kind of in the industry that we can't really measure, but a lot of dentists would agree majority of the dentistry we do is to fix and or replace someone else's work, right? Now, if that's my experience, you talk to any dentist, they're like, yeah, majority of the work I do is just to kind of repair and fix.
40% of the work in dental offices is repair of previous work.
It's a lot, you know, and if we don't live in a utopian world and not everything's perfect, and I understand every patient's different situations, I get it. But most dentists know when they're replacing someone else's work, they can kind of tell, like, this could have been done better. Like, and it's not a competitive thing. It's like, look, if you follow the ideal treatment process, you get the ideal result. And it's so easy to become complacent it's so easy. You can just I got to deal with speed, time, the patient's being a little difficult or whatever. We have all these variables that reduce the product's ideal capacity down. And I know that, and it's hard. And so then, we're like, okay, it's pretty good. It's good enough. It'll last 5 years. But then see what happens is in their mind, they're like, well, I'll just replace it in 5 years. And it's not like, I don't think they're thinking, yeah, I'm going to get double the money on this in 5 years. I don't think they're thinking that, but they're also not being reprimanded for it either.
Well, and the biggest problem is that every time you replace a filling, you're endangering the life of the tooth.
Yeah, it gets bigger.
I mean, the filling gets bigger, the nerve gets more irritated, the chance of that tooth dying increases. How many replacements do you think before a tooth dies? I say 2, maybe 3. If you have
I'd say probably like 3 or 4.
And the thing is, it will then take 10 years to show, possibly 5 to 10 years for that tooth to slowly die. And then you've got the problem of this infection, the need for a root canal.
That ends into an entire different realm, which we will enter into. But yeah, it's this that we call in biomedics, we learn something of a cycle of tooth death. It starts the moment we do the first filling. That's the moment, what's like the ticker starts. The first domino that falls is the moment you touch that tooth with some sort of restorative work. And the moment you start that ticker, then, it then goes into, it gets bigger and bigger. And as the miles are put on that tooth and, maybe the diet wasn't discussed, there's all these other variables that are going to reduce the lifespan. Yeah, lifespan, thank you, of that filling. Then, then goes into another, turns into a bigger filling, which turns into a crown, which turns into a root canal, which turns into an extraction and implant. And that's the cycle. And so biomedics stops that at a certain point because they're higher level of understanding of biomechanics of teeth.
I think we got to explain what biomimetic dentistry
is. Okay, sure, that's a great idea.
I mean, I have talked about it in some of my other videos, but when I've been involved in biomimetic dentistry, now this is mimicking nature. It's not biologic dentistry. It is a different category because these dentists study teeth and are in awe at the structure, natural structure of enamel and the way it is all designed to support the strength of biting, which is pretty intense forces. And these biomimetic dentists have got together, I don't know when they formed, but I think
25 years ago, something 25, 30 years ago in Japan, the Japanese scientists, so they're like, hey, I think we're looking at teeth. We have a very myopic view of the biomechanical structure of the tooth itself. And so they started utilizing higher level of technology to truly study what's going on when you chew, like mechanically, what's happening to the tooth. And then they really looked at enamel. Well, enamel is a certain crystal, but dentin is a collagen. And now we have this crystal and collagen, and yet they seem to work together. But in dental school, they didn't teach us the stuff I learned from
you didn't hear any of that.
They teach it to you, but they don't really, they kind of glaze over it. They're like, yeah, this is your enamel, this is your dentin, blah, blah, blah. They don't really truly get into the true mechanics.
The beauty of the mechanics. I mean, it's unbelievable when you look at how the forces are dissipated is what the word, but it just means melted through the tooth when it's in its pristine structure.
Yeah.
Whereas you cut into it and you change everything.
They don't talk about that in dental school. And even to this day, they do not speak about what happens when you literally cut into structure. You're shattering the enamel and you're shattering the enamel crystal rods and you're creating actually a broken enamel structure. And then you just put a filling in there like blah, 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 it's good to go. But you didn't realize you actually damaged that. And now that filling will never truly be as good, if you didn't do that. Like maybe you should look. So it's more like really looking into the finest points of what we're doing microscopically, nano, and really truly understanding the most complex formations of the teeth.
It's wild.
It's incredible.
And these guys have gone into such detail. They got together. They got other dentists
and they
all across the world, and they got together. There are Italians. There are
Japanese, Italians, Germans. And what I love is so when I use fiberglass a lot, and fiberglass is one of the major materials that we use. And again, it's glass and it's just fiber. So it's biocompatible. It's ceramics is basically what it is. So I like that the Japanese were like, well, a tooth is under load, compressive load. If you put a filling in there, when you bite together, that the filling that we know, just a solid piece of, could be resin, it's made of plastic mostly, or the higher end ones are made of ceramic, but just compressive load sends the force out to the tooth. And because the filling and the tooth are not the same structure, the tooth cannot withstand that force because it's on compression and it can't handle shear and transverse forces. So fillings inherently degrade. They degrade themselves, but they also send shock waves to the tooth that creates microfractures. These microfractures then create more fractures.
And then you have a little opening, and then if you've got a mouthful of bad bacteria, they get in those little openings. And when you started out with a nice little center, your dentist said, it's just a little small filling in the middle. Suddenly you've got a 3-surface filling because you've got these little cracks on the side that got infected by your bacteria in your saliva that happened to get in those little micro cracks. And then now you got a 3-surface filling, or
it just grows because they did not traditional dental. I mean, just dental. We did not truly understand what we were doing. I mean, they're doing a good job, and because it worked for so long, no one talked about the ramifications of amalgam fillings literally shattering teeth, or the original composite fillings breaking teeth or causing more breakdown because years went by and we didn't really look at what we were doing.
Nobody was looking at the long term.
No one's looking at the long term.
And I think it got worse and worse as the hygienist component of dental practice. You know, most of my friends, and I'm included, started dental practice on our own. There was no such thing as a hygienist for me. I used to clean the teeth, and then I would educate, and I would do the fillings as necessary, and you get to know that patient, that family in a completely different way.
I would love to segue into this, and I mean, I'm sure I'm going to get it from hygienists across the planet. I do all my cleanings, and honestly, all my friends think I'm crazy. They're like, why would you do this?
I totally get it. Because
15 years of doing, like, they're like, how do you do this? How do you have the time? I go, how do you not have the time?
It's so instructional to see a patient walk in and know. Otherwise, it's like a crime scene. You know? What we do today in dentistry is we have the hygienist scale, polish, clean, take x-rays, and then the dentist walks in. He's walking into a crime scene that has been cleaned up. There is no evidence.
That's very true. Yeah, I always do. Generally, I mean, I have a hygienist, and she's doing her thing, but when patients come in for the first time and I'm doing my exam, part of my exam is the cleaning. What they don't realize is, like, the more my eyes are looking at your tissues, and as I'm cleaning it, I'm like, okay, you have inflammation here and out there, and I'm adding this all up to create, recommendations for you. But when you split the hygienist does her thing, I'm doing my thing, I can't be a good quarterback. I cannot see the whole field, and so therefore I cannot make a good winning play.
Absolutely, 100%. And I think that's what's happened is this segmentation. And then the specialization. And so you're sending patients out. I mean, I worked in a practice where, crowns were done over here and root canals were done over here, and nobody followed this patient.
It's follow-up. And I think that actually goes into another point is people are allowed to move around and be nomadic and go everywhere, or you go to an office and then you see one doctor and then 2 years later that guy's gone and another lady comes in, and then there's no follow-up, and that lack of follow-up is lack of care. And so people think that it's like dentistry is not like you go and you order a hamburger at McDonald's and then you go and you get another one, everything's identical. You got to realize every dentist is literally different. A little bit differences, a little bit different.
Because it's so much is observational, so much is judgment.
It's artwork, it's science, and like you can't. I know we have to have education. We have to teach people. I get it, but patients keep jumping around to different offices. Well, my insurance, my this, I'm doing. They don't realize you're changing care partners. And so, in my practice, I've been going 10 years. I know after so many years, you see your mistakes or you see things that were not ideal come back, and I'm like, oh, you know what? Let me make changes. And now where I'm at now to where I was 1 year ago, I mean, I've evolved. But if people don't allow for that evolvement to occur because they bounce around, that's a problem.
Well, and dental judgment. I mean, one of the things I thought about, because when I came to America, I'd already had a lot of experience in different countries, in different fields. I'd been in oral surgery. That's where I began. I was then in family practice. Then I became a special needs dentist and school dentist. And then I had my own practice and saw families. And, over a span of 10, 12 years. And then I went back to school, coming to America. And I'm in class with people who just left dental school. I, meanwhile, have treated all these different categories of patient. I know what goes on. Mm-hmm. And I feel sorry because pediatric dentistry is taught to brand new dental students who leave school, learn 2 years. Now they're pediatric dentists. And they do everything they can to get that child to the age of 16, 17, whatever, with everything looks great. You know, they've sealed every crevice and they've filled every tooth that needed it, and they put braces, whatever is necessary. It's looking good at 16 and out the door. But have they got any concept of what that child looks like at 26?
I mean, I'm shaking my head when you say sealants, because if I had a nickel for every time a sealant, I have patients come in and they're adults and I'm like, you have a cavity here, here, here. And they're like, why do I have so many cavities? That's sealants, because no one followed the sealant up.
Well, sealants don't prevent.
No,
they simply block the crevices. And if you don't then get on a preventive program, and we don't even know. I mean, my contention with sealants is they are the crevices into which bacteria was supposed to get a foothold. If your mouth is healthy, that's how the Finns do this in Finland. They work on preschoolers with xylitol to get the mouths healthy, so that by the time the first permanent molars come in at 5 years old in kindergarten, the grooves, the central fissures of the grooves of these new molars are infected or colonized, as we call it. Same principle.
With the good guys.
With the good guys.
Yeah.
They then become a fountain for the mouth. I mean, it's such a obvious thing. In America, we go, the grooves of first molars decay all the time. Let's block them up. But we've done nothing about the environment. It's like having a room full of smoke and saying, let's just cover the table so they don't get smoke on them. Yeah. But you don't open the windows and clear the smoke out. Mm-hmm. And I don't know how we get this new message across to people that sealants are a Band-Aid that lasts for 10 years.
But it's a profitable Band-Aid. And, you know, we're taught in school, we're actually just browbeat with it. Sealants, got to do sealants.
Really? That's what you...
It's nonstop. But I mean, in my younger self, I never thought, well, we're supposed to have grooves. Like, you know, as I got older, I'm like, well, we're supposed to have grooves in our teeth and we're supposed to do this. And like, the design was designed and I didn't make the design. And I also don't think I should really intercede in the design, you know, unless necessary. And so like, I'm putting this material into these things, but I'm never truly getting the material in there because that is a really small void.
Well, they used to teach us in my pediatric specialty course to clean the grooves, enameloplasty. So you're basically drilling away the grooves. You're drilling the
making
tooth,
it bigger,
making a filling, a white filling, to save that child from a filling. I mean, that was when I'm like, something is seriously wrong.
Make it bigger to make it smaller. You know that term they remember for GV Black, extend to prevent?
Yes. Oh, yeah.
You know, and the thing was GV Black, you know, hey, he did what he was supposed to do when he did it, and he was needed at that time. I get it. Extend to prevent, because they had to fit that material in the tooth. And they're like, okay, let's just...
We're talking about silver amalgam, of course.
We're talking about amalgam. And so, you know, and he created the designs and everything, and he did, you know...
He was a German engineer, I think. And he did mini engineering on teeth in such a way. I mean, the equipment we used, I mean, I remember the old handpiece with, I mean, I'm that
old.
Mean
the...
Yeah, I am that old, yeah. And just the rotary little...
Well, still it works. You know.
Well, it was what it was. But G.V. Black was this German engineer that designed all these little mini spoons and hatchets. And did you ever use all those tools? Yeah.
I've done thousands of them out.
The grooves and the screws. And
they're all cool little tools.
They're so
honestly,
incredible.
I may not be a fan of amalgam or whatever my opinions on amalgam. I enjoy doing them because I thought the science was cool.
Science is
you
really
mix this thing up, you take this thing and you blap it in there. It's like malleable metal, and you're like working the metal into this hole, and then you get to do metallurgy.
Beautiful. No, and it can look beautiful.
As a dental nerd, I'm like, this is so cool. And then you carve it, and you're like, oh my God, it's beautiful. Yeah. This is stunning. And granted, I enjoyed it from the nerdy part. And I mean, going forward now, I understand mechanics a little bit better, and probably not the best thing. But the point is, extend to prevent is still stuck in the education model, even though they don't necessarily say it, it's still there. And we still have this mindset, like, let's obliterate and then cover. Obliterate, like that's what a crown is. Like, let's just cut all the healthy stuff off. And then we got this ceramic cover. It looks good. It seems like it'll work, but you just extended to prevent again.
And you probably upset the nerve in the tooth. And
the damage for a crown, I mean,
what do you think? I mean, that's a topic.
We can enter that topic when we segue into it. We might as well. So, though, again, a crown is it's an extend to prevent mentality, and it came from, I think 1900s was the first time we really started using dental crowns.
Really?
Early 1900s, 1903, and at the time they were using metal, obviously, you know. And I believe it was gold. And
Well, gold crowns probably were the best.
It's the gold standard for a reason. Gold is it's a noble metal. The body likes it. It's antibacterial, it promotes healthy biome, and the body likes gold. Obviously
it's expensive.
It's expensive, and the technique to do fillings and crowns, I mean, it's long past by now. I got lucky. I was able to do one gold filling, and I was able to do multiple gold crowns when I was in dental school. So I've actually made the crown itself, waxed it up, did the whole investment. I enjoyed it. I thought it was cool. Like you said, the nerd inside me is like, this is so great. But again, we don't do that. But the thing is, it was extend to prevent to do a crown. And the understanding of how a tooth works and what we're doing, we cutting this enamel off, weakens the tooth. You're literally taking out the entire foundation, the outer structure of a foundation of a building, and then putting another material on there that is not the same as the original one. It looks good, it feels good, but over time, because you've weakened that tooth, it's going to send microfractures along the base of it. And eventually those microfractures are going to reinfiltrate with bacteria. Now this crown either pops off, needs a root canal, or it breaks. And, every general dentist, I've said that I am not a proponent of crowns unless the tooth is completely obliterated. They get mad. They're like, no, crowns are very great, but they're not looking at the long term, right?
What would you do instead? What would you do? Somebody's got a pretty big filling to...
Let's talk percentages. Okay. So like say we have a third of the occlusal, 50% of the occlusal section is missing, right? So most dentists like, look, you have so much surface area of your tooth is missing. You put a large filling in there, one of the cusps is gonna break. That's usually where dentists like, I need cuspal coverage, it's gonna break. So I usually say, when the overall occlusal mass is about more than 50% needs restoration, then I talk about doing a fiberglass reinforced composite.
And how is that different? What is the difference between this fiberglass? I know what it is. I've taken biomimetic dentistry course, but for somebody, how would you describe the difference so they would know that how are they going to stick this in if it's such a massive thing?
Basically, you're doing a biomimetic filling, even if you don't even use fiberglass, is still different than doing a regular filling. It's understanding that there's these forces called shrinkage stress that you have to mitigate. And shrinkage stress is whenever you put a filling in there and we have these lights that cure the filling to make them hard. They go from malleable to hard. And when that reaction occurs, stress is placed on the tooth. And the bigger the filling mass that you do, the more stress you're going to have. And so dentistry has been taught, go faster, go cheaper, and it'll work. But every time you do faster and cheaper, there's a trade-off for that benefit. And that trade-off is going to be shrinkage stress.
That's why everybody's white filling today hurts when they've had it done.
Yeah, you're going to have postoperative sensitivity. You bite down, it's sensitive over time. It's sensitive. It's because...
Do you think all those teeth die?
They don't necessarily die. It's about microfractures. These fractures develop, and then they start leaking. Then you need a bigger filling, and the cycle of death, breakdown of the tooth is occurring. But a lot of it comes down to shrinkage stress. Initially, when they put it in there, and then now that shrinkage stress is like, when you put a filling in a tooth and you light cure it, you get it hard, it literally pulls on the tooth. And now there's a stress within the structure, and that stress is ongoing. Then that tooth is already under stress, and now they're clenching, they're grinding, they're eating ice, and they're doing other stresses. So you're redlining the stress capacity of the enamel structure. And eventually it will fail at a much higher rate than if shrinkage stress was near zero. And that's what biomimetics does.
Because they understand it, so they're layering it.
They're layering, so what
fabric in.
Exactly. Yeah. So originally what I did was back in, before I was biomimetic, the 3M and all the companies, the high-end companies, like we have this bulk filling. You put 5 millimeters in, you cure it, save you a ton of time, and everything's great. And I bought into it. I mean, how would I know? Yeah, it seems great, it looks great, it feels great, everything's great. But now I know better. So what we would do, if instead of doing that would be like one layer, it could be 16 layers. It'll take me like an hour and a half to do a filling, but they'll have damn near no shrinkage stress. that filling will look phenomenal. Sometimes people are like, is that a crown?
Yeah.
No, that's a filling.
No.
But I was able to slow down, take my time, be super methodical, because I know now I've mitigated shrinkage stress. The likelihood of fractures near zero. This thing is
It's not going to damage
mimicking the biology of the original tooth.
And the tooth is probably going to, I mean, people will say, oh, your fillings are expensive.
Yeah, sure.
But if you compare the replacement, the root canal, the crown, the implant, the extraction is the alternative. It's a bargain.
It's a bargain. So I have this little saying I'd say to my patients, you have two options, not just in dentistry, but in life. You can either trade short-term gain for long-term pain.
That would be the cheap filling.
That'd be the cheap filling. That's the bulk fill. That's all the thing when they're like.
But what you do is expensive. So that's the short-term pain.
Short-term pain for long-term gain.
Exactly.
So yeah, I mean, and then it's like with everything, like whenever you take shortcuts, and I tell my patients, whenever you take shortcuts with the body, you're going to pay for that. You're going to pay for it forever. And so I'll take an hour and a half to do a filling. And to my friends and colleagues who are not biomimetic, they think that is crazy. But they got to realize I'm going to be methodical and I'm going to be very, very precise in every movement that I do. And I'm going to take it I'll get excited sometimes because I love doing fillings like this, because when you're doing it, you're literally the best. It's not getting better than this. This is the best in the world that anyone could do. Absolutely. Skill-wise. And you know that, like, it's like when you're driving your car and then you see F1 racers. F1 racers are the best drivers in the world driving they're at the tip. It doesn't get better than that.
Yeah.
And when you're doing a filling at the tip, it's the best.
Yeah.
It makes you feel good.
Yeah.
And you know you're doing
something.
something.
You studied for it. How many hours do you study for that?
That's a lot. This is
a weekend of
No, it wasn't a weekend course.
Well, exactly. I mean, this is hours, and it's taught by people who are
passionate,
so passionate. And I got invited because one of the things about biomimetic dentists who do this kind of work, they're really interested in home care prevention.
They're very passionate dentists. That whole grouping of all the biomimetics that I talked to and met and just, messaging, and I show them my cases and they're like, that's amazing. And they're just so passionate about really, truly doing what's best for the body.
Right.
And so becoming a biomimetic dentist got me into holistic dentistry and a holistic mindset, because I'm like, well, how do I do the best for this tooth?
The trouble with biomimetics, I mean, my daughter lives in Montana and there isn't one. I mean, you can do a Google search for biomimetic dentist. There's no one in Montana. There's no one in Wyoming right now. There's, you have to search. They have a website that does allow you to search for
providers in your area.
But I mean, if a dentist is watching this and says, that's what I want to do, they should get in touch with you, right? Or the organization.
Academy of Biomimetic Dentists.
And go to some of these courses.
And just like you can watch them online. You can go to the courses. There's multiple. There's this guy named Dr. Najad, Matt Najad. He's in LA. He's got a great biomimetic institute. And he started with the same organization I did, but he just took it to another planet. I mean, what he does is just truly amazing. And I mean, if dentists want to learn, but again, you have to want to do better. You have to have a mindset. Every biomimetic dentist has the same mindset. I can do better. I can do better than what I was taught. And you have to have that seeking, that thirst for knowledge, that you can still evolve, where a lot of dentists just are like, I'm okay. I'm going to put the blinders on, and I'm never going to get outside of this because I'm comfortable and everything seems to work. And
they've got payments.
Again,
they've got,
I get it.
You come out of school today, right? How much do most dentists carry in
$500,000
in debt? And so they have to make money.
Yeah, you got to do it. And then the industry is not allowing you to do this.
No.
Because insurance doesn't pay for it.
No.
So then a lot of doctors who are taking, this goes back to the insurance model. If you're in the insurance model, your ability to evolve is minimized because they won't allow it. You're still doing 1970s level dentistry, maybe slightly different, but you're basically extending to prevent. You're cutting teeth down to nubs to do crowns. This is from the 1900s. And if your mind does not work, it's the 2000s. And that's why I always get a little bit passionate about this. I'm like, everything changes.
Well, everything changes. And if you're not open to change,
you know what?
one of the things that bothers me is, I'm all about the microbiome.
Yeah, I mean,
In 2007, they had this human microbiome project where they started measuring in multi-centered stations. They were measuring a lot of patients, the biome of the mouth, the gut, every skin, everywhere. And then by 2015, we had a new concept of body health. Our body isn't just our body. Our gut isn't just a tube. We have all these bacteria, pounds of bacteria on our body. And the vast majority are healthy bacteria that look after us. I mean, our digestive tract is just the center of our immune system.
It's mind-boggling. There's a statistic that says if you just measure the number of DNA in the body, right? Out of every 10 cells in the body, DNA-wise, every 10 cells, one of them is human. So they're saying the other 9 cells of DNA are not human.
They're literally just bacteria and fungi and different things.
So,
and in the mouth,
makes you wonder.
We used to think we had plaque in the mouth. We used to think there was this bad plaque called biofilm.
All plaque is bad.
And all plaque is, because plaque and biofilm words were connected. I've dissociated them and said there's healthy biofilm and unhealthy biofilm. And the unhealthy is plaque. But you don't have to have it. If you grow up in these countries where you're in preschool and they're giving you xylitol and your mom had xylitol and you know how to look after your teeth and you're allowing the good bacteria to enter these fissures instead of sealing them all up, and those children are growing up, they have healthy biofilm. When that occurs, they need minimal treatment. It's that simple.
The minimal treatment's where it's at.
Healthy bacteria know how to help themselves. And it is so unfortunate that we are unable to evolve because the education system is unable to evolve. It's not dentists.
No.
I don't hate dentists.
I don't.
I mean, they're super great people, but if you come out of dental school, you've learned this stuff, maybe you even specialized in this stuff, and then you went into a factory type environment.
Yes.
What are you going to learn? Nothing except the culture of that dental practice, which may be owned by a businessman, right? May not even be a dentist.
Owned by a corporation. I don't know what the percentage is, like 50% of dental offices are now corporate owned. And so, I mean, the mindset's not getting any better. And so it's
not from that. So patients need to be the shoppers.
Yeah.
And they need to not be looking for insurance coverage. They need to be looking for probably a dentist of your age, who's at least been in practice for 15 years, right? Would you want to go to one younger than that?
Okay, so here's the thing. I mean, this is a double-edged sword. This is a double-edged sword. It's a double-edged sword. I was out of school once, and I worked at a corporate office, and like people came there, they have to entrust that I have a degree, I know what I'm doing. Now, I think you go to a restaurant and you go to like a fast food restaurant, you don't expect to get the greatest meal of your life.
No.
Right? So you should also know kind of where you're at. You should have some sense of like, all right, I'm going to this office and that guy looks like he's young and he has no grays, and that's fine. That's, but you can kind of tell, like, don't think that person is going to be the greatest. I think people should understand, like, you can't expect us. What I'm saying is,
you learned a lot.
We're not identical.
You learn a lot in dentistry. If you're doing a lot of work,
you get better with time. All surgeons, everyone in medical, if you're touching a human being and you're actually doing something to them, you're going to get better over time.
Exactly.
There's a standard of care we should never fall below, but when you're younger, you're going to make a lot of mistakes.
And you're not going to see. You only know what you've seen. I mean, I argue with dentists who say, once the caries into dentin, it won't reverse. And I have seen it reverse. So don't tell me that. But I can't convince you because you've never seen it happen. Because maybe you didn't leave it long enough. Maybe you didn't use the right techniques. Maybe you didn't put it all together or educate the patient in a particular way. So you only know what you know or what you were taught.
Yeah, and then we're educated to certain, other schools do a standard of care, but like there's so little energy put on prevention. I mean, if I looked at my entire dental education, I'd say 1% was on prevention. Yeah, they're like, okay, high fructose corn syrup, polysaccharides, simple carbohydrates, cavities, talk about it a little bit. And then let's move on to amalgams and fillings and crowns. I mean, honestly, they didn't teach us anything. When I talk to my patients about, like, and I stop and go, okay, this is what's going on. And I can tell based on what someone's teeth looks like, I can tell you what kind of soda you're drinking. That's a Dr. Pepper. That's a Mountain Dew. That's Coca-Cola. That's Topo Chico. You can just tell. That's chocolate. That's kombucha.
Well, and candies, people that suck candies have the
you can tell if the candy is
on the inside.
It's a lemon lime. You can tell if it's, you can tell there's patterns. You can tell if someone's bulimic. You can tell if someone is acid reflux. You can tell. And the thing is, they didn't teach us any of this.
No, when I wrote Kiss Your Dentist Goodbye book, my main goal was to say it isn't just sugar that damages teeth. It's because sugar turns to acids and everything is about acidity. Carbohydrates turn to acids. And the damage isn't done. You can soak a tooth in sugar. The sugar isn't the problem. The sugar is feeding the acid-producing bacteria. So everything boils down to acidity. And then I'm thinking, well, if that happens, then what about soda drinkers? And I had to figure it out for myself back in the day. But then that brings me to the other thing that I'm passionate about. Most of the research was done in the old days with men, not with women. And I remember the studies were done that said, saliva is pH of 7. No, it's not.
It's not.
No, it's not. Some young, healthy men, probably the dental students they were testing at the time, have a pH of 7. But you take a pregnant woman or an older woman or somebody with dry mouth, they haven't got a pH of 7.
No, they do not.
Their own saliva is doing the damage because their saliva has a pH of 5.5 or 6. And to tell that woman that she's got plaque and needs to floss more or isn't following directions and she may be flossing all day long, it's not going to help if the problem is acidic saliva. That's where you need xylitol. Did they ever teach you about xylitol in dental school?
No.
Not a word.
I don't recall xylitol. Maybe I do recall maybe a tiny bit, but this could have came after dental school. I don't recall xylitol being used. Is maybe a lecture, maybe like 5 minutes. Oh yeah, use some xylitol here and there, but they never said, oh, this is a program, this is what we need to do, this is what it does, this is how it works.
Because I think that's why dentists have not been, supportive, have not been, patients say to me, why didn't he ever tell me about xylitol?
Well,
he never knew. He didn't know.
I look at where I am now with my understanding, and I look at my young self when I was a dentist. I know 1,000 times more, and that just comes with age. That's natural. But the amount of stuff they teach you, they teach you what's I call the bare ass minimum. Literally, they're teaching you a little bit, but the education, they need to change the entire education model. It's got to go 90% prevention, 10% treatment. Yeah. Now, it's literally the exact 2% prevention and 98% treatment.
But how you'll only get that to happen if you pay for it. You figure out a way to make it.
You got to figure it out on your own. But you can make it financially. That's the thing is, I use lasers in my office instead of like using my drills all the time. We spend time talking about diet and things like that because, I don't get paid for dietary consultations, but like,
how do they find other dentists like you?
You can grow them. I developed, as my own person, but you can literally grow this type of person.
Who can?
The education system.
Do we need a separate from the current dental schools? Do we need a new place that would educate dentists like this? Or how do we do this?
I think at the end of the day, it comes down to society again. I'll always bring it back to their mindset. They need to demand more of their practitioners. You don't go to a dentist, goes, okay, you need this, you need that, you need this. Great. Well, why do I need it?
Yeah.
Ask questions, demand changes.
Never agree. I say never agree to your treatment plan while you're sitting in the chair. When you're lying down or because there's a power position. Get out of the chair and let's talk about it. Or give me it and I'll take it home and think about it.
I agree that I think they should at least demand, well, okay, if this is what I need, ask, well, how did I get here? Well, how did this happen?
Why is this happening?
Why is this happening? How do I prevent it from the future? So I think people just don't know how to ask these questions.
They're intimidated.
They're
I think most
intimidated,
people,
or
I tell them, do I
you know.
need a cleaning? I mean, you know, my story, I haven't had a cleaning in
and like since time began. I know. You're like-
40 years. And I'm trying to tell people that they need to ask that question, do I need a cleaning? Because if you don't need one, you don't need one. Then you know you're going in the right direction. I'm not saying you should never have one.
Yeah.
It's fine. But if they say, yes, you do, because you've got calculus here, or you've got a pocket up here, then you know where you need to focus your attention.
I mean, it's
You
case
need that
specific, and we've been kind of treating people as everyone's the same. And insurance created that kind of model as well. Everyone's the same. You get this much money, and the dentists are like, okay, I got $1,500 to spend on this person. So it creates this non-preventative mindset.
Yeah.
But again, the system was set up. We're still playing into it. Both society, education system, all the healthcare, the practitioners.
We're going to try and.
I'll do my best.
We're trying to change it.
I think it's slow, but again, I tell patients, and on my TikTok, you have to demand more from your practitioner. If they give you a night guard, why do I need this night guard?
Let's talk about night guards. Let's just talk about night guards. Because everybody and their sister has just spent $600 or more on a night guard. I don't think I ever made a night guard in my entire career.
I made a lot of them, and
Really?
I got into them and went, because I have very bad TMJ, TMD, temporomandibular disorder. TMJ, for everyone must know, is just a location of a point. TMJ is my joint. TMJD is the disorder of the joint. I have TMJD, and I've had it for over 25 years. I was taught that I need a night guard. I was taught that I just have to just stabilize my joint so that way the capsule wouldn't get so much force and stay inflamed. And I was like, yeah, okay, that's what I'll wear, a night guard, and that's what I'll do. And then one day I came across this fella, dentist, Dr. Liao, Felix Liao. He's like, yeah, but why are you clenching your teeth in the first place?
Exactly.
And it like blew my mind. It's like such a simple question that I never asked myself, and I never asked myself when I'm giving millions of night guards to all these people.
I never.
It's just like, well, yeah, the house is on fire. Here, wear this fireproof jacket.
Yes, exactly.
And literally, this is the mindset of every dentist, And then
and some of these people, they're told by the dentist, I can see you're grinding your teeth because they see
symptoms of clenching and grinding.
It's the symptom. Why are they seeing these symptoms? I mean, tooth enamel is harder than steel.
It's incredibly strong.
Hardness of 5, I believe. So why is it wearing away like that? It's because of acidity. Acidity will soften it. What are they using? I mean, if they're opposed to fluoride, they're using, for example, just going to use an example, Tom's of Maine, #1 selling natural mouth rinse, has a pH of 3. So if you rinse with that, right? Yeah.
I'm so confused.
Yes. If you rinse with that right before, it's the top selling natural.
And its pH is 3?
pH is 3 or 3.5.
Well, whatever. That's insane. That's like closer to battery acid.
Well, Biotine was the same. Their Biotine is for dry mouth. I think they may have changed it recently, but for years it had a pH of like 4.5.
My.
You use that right before you go to bed and you grind your teeth, which we all do. You're going to have softened enamel.
It's going to obliterate.
I mean, that is, and I'm here to push the idea that I believe in, which is my complete mouth care system, because it results in extremely strong enamel, dense enamel, which I grind my teeth all the time. They don't wear away because the teeth are strong. Now, let's go back, though, to that whole thing of bruxism. And when it's not because you're using say somebody's using good night care with good fluoride mouth rinse or whatever before they go to sleep at night, and they are grinding their teeth and they're actually fracturing them, or
you'll get a lot of you'll get vertical fracture lines, and then once the pressure's too high for the teeth, then you'll notice these people have tori, exostoses. You see that happening now. The bone is trying to support the force.
And to describe that's the lumps in your bone are growing in various directions.
Yeah, bone lumps that are growing on your tongue side or on this side, but
it's all about these forces that you are putting on your teeth as you're sleeping at night. So what should they do? Should they have a night guard or do what?
I mean, the easiest thing, which again, I would tell every dentist, why are they clenching their teeth? You just have to ask a simple question. Instead of, and this is again where I'm going to get back to, the entire model needs to change, not just prevention, but to root cause solutions. Root cause long-term solutions, not long-term band-aids. And literally our entire education system from medical through dental is a long-term band-aid. And this needs to change because first our society has to demand, I don't want a band-aid anymore. I want a solution. And if you go to your practitioner, whether a medical doctor, a dentist, you demand that, they will eventually have to acquiesce and go, you know what, we have a demand, we have to create a supply.
What would you do for somebody who comes in and says, what do I do with this?
Well, I mean, first, if you want root cause solution, I go through what are the root causes of clenching. We start with, and this is recent studies have proven that you have upper airway restriction syndrome, or just say upper airway restriction. It's like 75% of people in the US have airway restriction from the tip of their nose through their sinus system. And anytime there's a restriction, the body, you will clench. You'll clench down. It just, just happens.
Because that opens up the muscle behind at the back of your nasopharynx, right? If you clench down, doesn't that change the shape there?
Well, what's happening there, and this is interesting, someone won the Nobel Prize for the discovery of something called nitric oxide.
Oh, sure.
And how it's all played into this thing. So what happens is, long story short, you have inflammation in your upper airway restriction, meaning you're being restricted by inflammation. And we'll get into why you're having that, but you have a restriction. So you have inflammation, then the cells that produce nitric oxide cannot produce it. Nitric oxide is a vasodilator. It regulates your heart system. And then if your nitric oxide goes down, it's inversely proportional to cortisol. What is cortisol? The stress hormone of the body. Now you've been releasing stress hormone throughout the body. You're stressed, you clench. I mean, when I learned that, I was like, that makes absolute sense. These are people who just, life is, and again, I'm not blaming society, but we have been force-fed to believe it's stress, accept it, move on with your life. And I find that insulting.
Yeah. And
you're insulting my intelligence to believe that I have to accept what's happening and I don't get an answer or a solution. It's stress. And I would talk to these patients, well, it's just stress. That is, you are now a victim. And you played into the whole sickness of our medical dental system.
Well, and I think
it's sad.
The more I look into this, the more I talk with patients now, because, I've been doing this for years, trying to find out what's underneath. What's the next layer of the onion that we have to figure out why this is. I'm totally convinced that chronic sinus problems could be called peridontitis of the sinus. The bacteria, inflammation.
It's connected.
It's totally connected. And I think that we may end up by getting more chronic sinus infections. And again, this is just a hypothesis of mine, because when people get allergies, the first thing they run for now is a nasal spray of some sort or a quick allergy fix that shrinks the tissues, that probably allow the allergens to go in deeper. Doesn't flush them out. It makes the allergens go in deeper.
It does a lot of things.
That probably creates this more chronic inflammatory response in our nasal passages, because we are giving children Claritin and these different medications at a young age. Instead of what the old days would be to either flush it out with salt water or xylitol, or, they make a xylitol nasal spray that doesn't dry up your nose like today's allergy medications. It actually makes your nose run, because the intent is to get those allergens out, get them away. And I just am convinced that this whole nasopharynx health, I don't know which comes first. I'm not sure which is
Well, I would say, the hierarchy of needs of the body is airway, breathing, circulation. So I would say, and I've told this to my patients, that oral hygiene, nasal hygiene, I see no difference. They're connected. So if you have a really great biome here, it's going to spread up here. If you have a bad biome over here, it's going to spread up there.
And vice versa.
Exactly. And so I
have a friend who had some kind of extraction implant problem where they actually perforated into the sinus. So then they got sinus issues.
From the mouth,
the whole thing has just become a circle that you can see started.
I see like endodontic treatment, root canals on teeth, especially the upper molars, they begin to leak. And because the path of least resistance, the sinus floor is right above the apex of this tooth, it'll just go right in there. It's
Yeah.
not punctured. The bacteria is like, oh, there's less pressure here. Let's go that way. And then it's in the base of their sinus, and they have no idea it's there. And what's inside there?
This
All
is the
kinds
problem
of
with
pure
the
evil.
minute you go down, we're going back to where we began our conversation. If you can reverse a cavity or avoid a cavity or have a
starts
really,
there.
really good filling that's going to last you for life, then do that. Don't do Band-Aid dentistry
No.
that leads you down. I mean, do you know that the average number of fillings per American is 12? That's 3 filled teeth on each quadrant.
Mm-hmm.
And if you look at the statistics, most of those are done by the age of 25 to 35, I think it is, somewhere in that, maybe 40. So if you have 12 fillings at the age of 40, you're bound to have, by the age of 65.
I basically have 12 ticking time bombs in my mouth.
Yeah.
You know, that's basically what
So
you
by
have.
the time you reach retirement, probably your financial advisor is saying you better save up for all the dental work you're going to have in your retirement, because you've got all these fillings that are going to need mega treatments as you get older. Why do older people need more dental treatments? It's just the downhill. It's the end of the slalom run,
we accept
right?
the fact that as you get older, everything breaks, and that's
it's
not
not
necessarily.
really
You don't have to be fragile. You can be agile.
Yeah. Well, that's another way of
That
saying
one just came out of nowhere. That was a good one.
But it's just a downhill slalom that we allow patients to run.
Yeah.
And they get to the end of life and they're already at that crown root canal mess stage. And some have them all out, and that isn't much better. And
yeah, that's why I love buying, because whenever I do it, like especially when I do a filling that has fiberglass in it, you know, and you got to realize what fiberglass is. It's basically like you're taking a really, really, really small piece of Kevlar vest. You're putting it on the base of this tooth, and it's connecting the walls and the base. Then you put the filling on top of that. I mean, this weave of this fiberglass, I mean, if you make it bigger, it's a Kevlar vest. It can stop a bullet. It does that by absorbing the forces. You can chew on that thing all day long and forever.
so cool.
It'll absorb the forces. And so therefore, I know that when I do these fillings, the mentors told me, they're like, these are lifetime fillings you're doing. These
So
should
cool.
be there forever. And then you talk to them about the complete mouth care system. And now everything else is literally taken care of. And they're like, oh, they're clenching. Well, let's just kind of talk about that a little bit. So you nailed every pot. So now that filling will last forever. It will never break. Their mouth is not going to get more decay, so that's never going to have an issue. And they're not putting high force clenching because their nasal area is under control. And these are all the 3 pods that I do with my patients.
I love talking with you. It's why I love talking with you. It's the best.
You know, but it's like a dentist has to go, what's more important? Like, I mean, when it's not, my mindset is not based around money. And I know that it's hard to teach that to other people, but if you put your mindset around outcome, the money will follow it. I swear to God, every dentist I talk to, just please understand, follow the outcome, not the money path. And you will get both.
Well, and you will have joy.
No,
The joy of
joy.
happy patients that understand what you're doing and appreciate you for what you are and see the outcome for their children and their children.
And filling's not breaking. Nothing's breaking. I mean, if I could explain to dentists what it's like, because I rarely do crowns, and I know you're going to have problems with that when you're doing fillings at this level. I don't have any problems. I literally have no issues. Nothing breaks.
Nothing breaks, and you're not going to have the root canals.
No one's complaining. No one's like, oh, this, that, the other. It's just the complaints just disappear. Yeah. That must mean that.
And it's the same thing if you do good prevention. I mean, I had minimal. I don't think I ever had anyone much ever cancel an appointment. People like to come.
People want to come in there.
And they would come as a family, and I charged by the hour, and people would come in, and the whole family was looking great. They'd be in and out in a short period of time. We could educate everybody in the family.
It's a fun experience when you have like a mother who's expecting. You're like, oh, hey, by the way, I want you to start you on Xylitol, change up your biome. So when you inoculate your child with your mouth, she's like, what do you mean inoculate? I'm like, yeah, tooth decay is actually the most common communicable disease on the planet.
Absolutely.
And it blows their mind.
Nobody's ever heard this, or if they have, they've got wrong information.
And you can talk to any medical doctor. What's the most common communicable disease in the world? They're like influenza, TB, and I'm like, yeah, it's tooth decay.
Oh, it's tooth decay.
And the number 2 is gum disease. And The fact that they don't know that means a lot. Means that, you've asked most dentists that question, they won't know the answer to it. They'll say influenza, TB. I'm like,
it's probably true. I hate to say it, but it's
I'm
probably
telling
true.
you ask them, they won't know. I ask dentist questions all the time. I'm like, what do you think of this? Like, I don't know what you're talking about. I'm like, I'm scared for everybody because that's just the way it is.
It is.
Society doesn't know.
Well, it isn't really funny either, because this is more than just about a pretty smile. It's if you don't understand what's going on in your mouth health and your sinus health and this whole sleeping, breathing, nitric oxide.
The sleeping, breathing thing has been one of the greatest things I'm so glad I got into it. And you got to realize I got into this because I was diagnosed with mild to moderate sleep apnea. That's why I was clenching. I was clenching.
So have you solved it?
So now I know what to do about it. Like I got into the realm of TMJ, and I love TMJ and everything TMJ because I have TMJD, and I did all the fancy night guards and the fancy TMJ splints, and look at all these great things I'm doing, but then I'm still clenching my teeth and I'm still having active pain. I'm like, sometimes, going to work when your dentist is in pain, it's not easy. It's not easy being it's very, it's difficult on my body structure to handle that level of pain. And so,
so what's the cause? Did you damage the TMJ originally then, do you think?
Through the clenching, bruxism and clenching over time. It's bone on bone contact. It's going to wear down. The muscles can only withstand so much eccentric forces, right? My knee is designed to walk. I keep jumping off a 10-story building and I wonder why my knee hurts.
Yes.
Right?
Okay.
So that was my TMJ, and I had to find the solution. Why am I clenching my teeth? So then I found out about upper airway restriction syndrome. So I went down that. I have a 3D imager in my office, got a 3D image, and they're like, yeah, I got restrictions all through my nasal passages. Okay, well, let me fix that. And then.
So how do you fix that? Did you expand your arches or?
So the overall system that I learned for what's called epigenetic maxillary expansion. So basically what I found out was if your maxilla, this is the middle third of your face, which basically makes your sinus cavity, your nasal cavity, and it's also the floor of your sinus, but it's also the ceiling of your mouth. So it's a very important bone. What I found out was if this thing is slightly restricted, meaning it didn't grow in its full dimension on the lateral aspects, the side to side, or the aspects in the front and back, that means it'll be squished. If it's squished, it's going to create narrow inflow, outflow tracts of your nasal system.
Right.
So that way it's going to get gunked up easier. Now I have more gunkiness going on. So more gunky, less nitric oxide, more cortisol clenching.
Right. Okay.
Not to mention I'm going to have sleep-related breathing problems and other issues, which is going to also increase my cortisol. So I've been living a life of cortisol explosion, excess for all these times. And the entire time, I just thought, it's stress. Oh, you're a dentist. It's stress.
One of the interesting things from just as a mom, I had 5 kids, and it wasn't in England when I grew up, they thought that bottle feeding was better than
we're going to jump on that.
And well, because the nipples of these bottles they were made almost like a straw.
Yeah.
So babies never sucked. So this palate, when a baby is born, of course, as you know, but for people watching, there's a big groove down the middle of the baby's. It's at the top of the vault of your mouth. And as the baby sucks, it literally pulls the bones down. And if you continue breastfeeding into the 2nd year of life or thereabouts, you'll do a really good job of helping the baby's bones, instead of being arched up and high, to actually be sucked, especially if the baby has to really suck hard. And today it's very interesting. I watched my kids nursing, and when they went over to bottle feeding, they now make nipples that make it hard for babies.
They've slowed it down.
So they've got the message here that a baby needs to create that vacuum, because it's so much better for letting the vault of the palate, this roof of your mouth, be pulled down and open up more nasal passages. Now, in England, when I was a kid, I think everybody had really high, look at, as a dentist.
Well, the malocclusion is astronomical. You guys were
did
a mess
one
over
malocclusion. Yes. Well, for a lot of reasons, but that was one of them. That who can explain to a Brit that part of their nasal breathing malocclusion, teeth too far forward in the top jaw, was all because their mom wasn't given a choice of a better nipple for the baby bottle.
Or they were told breastfeeding and bottle feeding there's no difference.
Yeah, exactly. I mean, this is the same thing. It's a sequence of destruction that begins with something so remote that nobody goes back to say, I wonder if it was because she was bottle fed. I mean, it wasn't until I was in practice going, everybody has these giant cathedral ceiling roofs of their mouths.
Yeah, narrow arch form, meaning narrow mouth, narrow maxilla. Yeah. So I asked my mom, I go, hey mom, how long was I breastfed? She's like, about 5-6 months. Yeah. Okay, well that explains why I had malocclusion, meaning my teeth were all jibber jabber, and I had to get oral surgery to bring my canines down because I had enough room. Then I had a bunch of braces, so that brought my narrow arch form more narrow, actually.
It's the beginning of it. And then what we love to do in British and American dentistry is take out teeth because they look crowded.
Yeah.
I see the same thing. Don't take out teeth unless you absolutely have
there for
to.
A reason. It's supposed to be there.
Oh, I mean, the bone doesn't grow if you don't have teeth. And it's so easy to see these crowded kids' teeth. I mean, I've had it with my own kids. They bring them to these grandchildren to me and go, would you look at her tooth? Because they're all crooked and crossed out. And I'm like, yeah, but she's 6 or 7 or 8 or 9. Wait, you guys are big. Your heads are much bigger than these kids' heads, and they're going to grow. And wait. Don't take out teeth unnecessarily.
Please don't. Yeah, and it's interesting. And when I think about all the knowledge I have of now skulls and how they develop, was I taught this in dental school? Zippo, zero, nada.
Really?
We're talking nothing. Did they teach us about what skulls were like 30,000 years ago? No. Did they talk about how the skull forms with breastfeeding? No. Like it was literally I don't want to get assassinated for saying this. I got to watch my words very carefully. But if you understand how the head and the skull and the mouth and the teeth develop, and then you look at where we are today, and you look at our treatments for what we're doing to get the teeth in alignment, we made some side steps that are not necessarily the best.
What do you think of people doing Invisalign today? I mean, this is a hot topic.
I mean, you know, I'm going to watch my words here. So society has come under the understanding that straight teeth that must be straight and they must be white for them to be great.
Yeah.
Okay. And once that was set into their mind, they'll do anything to get it. And modern orthodontics it's about retractive movements of teeth, meaning it coming inward. So Invisalign, they dust off 0.2, 0.1, 0.4 millimeters of enamel in between your teeth and then bring them inward to get them.
Oh, I didn't know that.
Yeah, they're always
bring them in.
Bring them in. Modern orthodontics, they use braces to bring it in. That's retractive. It's bringing it in.
I didn't know that.
Now, if you understood why those teeth, no one ever asked this question. Did anyone ask this question? But why are their teeth all jumbly? First of all, you didn't have enough room. Why didn't you have enough room? It's a simple question that I never asked my orthodontic mind when I was doing like Invisalign on patients and when I was learning orthodontics. No one ever said, but why are their teeth like that? I don't know. Everyone's just genetics. Genetics. No. It's because your maxilla is not big enough because your mom never breastfed. That's why. But no one said it. No one talks about it. But now we know that breastfeeding, just like you described, it makes your jaw nice and broad and so that your teeth will come into play. If it's not broad, the teeth are like, oh, I'm going to do whatever I can. So Invisalign doing it, but they're pulling it in. So the original problem was it was too small.
And now we're making
it smaller. And now you're wondering, now, again, this is my opinion at this point. Are there studies and secret studies done out there that no one knows about? Absolutely. You have people who've had the wisdom teeth taken out because they didn't have enough room for them, so their jaws are too small.
But they didn't leave them long enough to grow.
They had 4 bicuspids taken out, another, teeth taken out. Now we made this mouth so tiny, and then we gave them braces and we pulled them in. Generally, when you get that many teeth taken out, I'm not going to, just in my opinion, all these people get sleep apnea. It's like a guarantee. You're going to have sleep apnea. Your face is now this way, and you're like, I can't breathe. And you're wondering, well, because you lost the formation of your jaw. has then been pulled in. So now we have sleep apnea is literally, it's like a pandemic.
It's a pandemic at the moment.
You know, and sleep apnea is like, people don't realize there's sleep apnea and there's pre-sleep apnea that no doctor is going to talk about it. This is the world I live in, where I see, okay, you're wearing your teeth down, you have abfraction, you know, you have lots of recession, all these symptoms. Your tongue has, you know, have those marks on your teeth where you're pressing your tongue scalloping. You have all these symptoms. This we know is pre-sleep apnea. This individual is getting sleep apnea. It's going to happen. So I can catch it when they're younger, even as children. They're breathing through the mouth breathing. Now we know that kids who mouth breathe coincidentally always have some sort of ADD issue. Now, the studies are being done, but they're not letting it out because, well, I mean, this could get into a conspiracy theory, but the pharmaceutical industry, the medical industry makes so much darn money off of these messed up kids, and all we have to do is put them back on the breast, and all these problems will go away. Orthodontics don't need it. Wisdom teeth come in, teeth are perfectly straight. We have no sleep apnea, no heart disease, I mean, it will like break the system if you did it the right way. But I think society, again, conspiracy, that's my thing. But if we just make sure society doesn't do what we're designed to do, we'll stay in the unhealthy path forever. But do you see what I'm saying?
Oh, I do.
I mean,
and it's the same thing with prevention. If we instead of trying to seal the teeth of 5-year-olds and 6-year-olds and patch up where we're going, if we simply change the biome of pregnant mothers,
it's easy.
And I was at the Eastman Dental Center when I wanted to do that. I was the clinic director there. I had every opportunity to do this, but couldn't get the funding. They would never fund it because nobody is interested in funding something that doesn't. That's the problem. And then people say to me, where are your studies? Where's the...
I get that constantly. Where's your studies? Where's your studies?
There's nobody funding. There's no reason to fund something like... I mean, I have patients
You're right. No one wants to study it.
Just like me, on my complete mouth care system with not a single dental problem in the world. Who is going to fund that study?
I mean, we get it too in the sleep apnea, in the airway division. I mean, there are studies that are out there and like, but they don't want to be released or no one's pushing them out there. And if they are pushing them out there, they get... Well,
and that's the other thing. There were studies being done about simply the effect of sealant materials on young children, you know, the plastics, and they closed the labs down. I mean, I'm not a conspiracy theorist, I don't think, but when stuff like that happens...
Okay, this is a great segue to something that we both understand. The xylitol is going to give me a heart attack.
Oh gosh.
Debacle. Let me just talk about this because I noticed something like, you know, you taught me a lot about xylitol and thank God because now I understand it. I use it. I love it. So we started using xylitol and they've been using xylitol in the 60s, 70s, Europe, EU. These guys love it and it works great and no problems. And these guys, their level of healthcare is advanced and they're always looking to make sure they're making the right decision for the people.
Quarter of a tooth per person decay.
I mean, just incredible, right? They have way high standards, and it's been doing great since the 60s. And all of a sudden, xylitol. Now,
go ahead.
The moment xylitol became super popular in the United States. It's everywhere. Xylitol tabs, xylitol rinses, xylitol toothpaste, and it's like xylitol really works really well. But the moment it became incredibly popular in the United States, out of nowhere, it's going to give you a heart attack. Wait, what? You mean to tell me Scandinavia, Finland, Europe, Japan just somehow missed that? Absolutely not. And then you read the study and it's the dumbest work. It's like done by a 4-year-old.
Well, the thing is, they took the sickest 10 of the sickest people.
Yeah.
These people, I think 75% were diabetic or 50 to 75%. 20% were in cardiac failure.
It was,
the rest had all been in the cardiac clinic. They were all 65 and older. They had all been fasting. They were given 30 grams of xylitol.
A toxic dose.
I mean, in 2 minutes. And then they took blood out of their bodies. Nobody actually had a heart attack or any of them.
They had increased platelet aggregation.
Saw increased activity in the outside. And within 2 hours of that study, it was distributed everywhere. Yeah. I mean, because we get notified because I have the xylitol business. And so my first thing was, who funded this? And it's private equity groups. So you have to say there's a reason.
There's a reason why this information we speak of,
Why would you take 30 grams, find the sickest of the sick people, have no control study, and then put out to the media in such a way that they put out pictures of xylitol chewing gum I mean, in actual fact, the Cleveland Clinic, in their credit, said this has no relevance to the oral.
But no one's putting that out.
No.
No one's putting that
All
out.
the other studies that show it can be helpful when
Yeah.
you're doing chemotherapy, or that it reduces preterm birth in mothers. I mean, the body knows better than if you give 2 pieces of chewing gum to a pregnant woman in Malawi, they did the study, they significantly reduced preterm birth, early term birth. The body doesn't react like that to something it doesn't like. Xylitol is made by the body. We make 15 grams of it every day.
Blows my mind.
So this study put out by all these channels where you've got these elderly people now giving up xylitol.
Oh, I mean, on my channel on TikTok, I mean, the people are like, but it hurts you, it hurts you. So I'm like, and I did a video on it and everything. Like, you guys have to understand.
It goes on
look
forever
at the
now.
timing of this thing, and I know, and this goes back to anytime something is really helpful for society, there's always this bizarre, crazy, outlandish story to negate it, and to remove the power from the people. That's what it comes down to.
They call it clickbait, and I'm not sure whether it's media clickbait, but I'm going to go as far as to say, I think, and I'm going to put this on video now, that in a short period of time, we're going to find that somebody is promoting a sugar. We're going to go back to sugar, but sugar that's had something done to it by some pharmaceutical trick that makes sugar now far healthier than anything else.
So they're going to invent their own xylitol, is what you're saying?
Yeah,
that makes sense.
Can I put that out there? I don't know how they're going to do it, but it's a gymnastics edition, and they are just trying to get xylitol out of the way because it's such a delightful product. I am so thrilled with being involved in the xylitol world, and I'm glad you brought this up.
Yeah, no, it's something I've been thinking about it, and then it makes you think about all the other things. So, like, when I got into the airway thing, we have this oral device. It's it's actually the first treatment for sleep apnea that actually works. In the medical, CPAP is a treatment, but it doesn't actually. I can't say this. The word starts with the C and rhymes with "your."
Yeah.
Okay, I can't say that word, but it'll treat it and put it to remission. For most people, it'll treat sleep apnea and put it to remission for most people, into mild to moderate. It's even FDA approved for the treatment of severe people to bring their numbers down. It's called an AHI to normal. Now, and they can maintain that. And once you're done with treatment, you're done. You don't need anything, right? So now the thing with that is, to get that FDA approved, it took years and years and years to do it. And they were denied over and over and over again. Not because it didn't work, because there are other powers, the AMA, American Medical Association, and the pharmaceutical industry, which was somehow telling the FDA, we don't want these guys out there. Can you just kind of make it extremely difficult for them to get to out there? And now that they're out there, you don't hear about it. Well, no one knows about this. When I'm helping people with their sleep apnea, and I'm basically creating treatments that put it into near full remission for life, why doesn't anyone know about this?
I know. We've got to talk more.
Right?
We'll come back and
talk some more about
sleep apnea.
Yeah, sleep apnea, how it's an epidemic, and it easily could be prevented just by breastfeeding.
Yes, 100%. I'm so glad we began and ended with something that simple. But you got to tell your kids, and grandparents, I think, are going to be the leaders in the new revolution for community health. It's got to be grandparents teaching the kids who don't know yet how important it is for the grandkids.
I agree.
Yeah.